with a higher self-esteem and with more positive thoughts comes, one would imagine, a better way to handle adversity, a better way to handle stress. With a low self-esteem and a negative mindset, when life's stresses come at you, how are you going to get back up?
Well, I think I came here tonight specifically to discuss stress and cardiovascular disease, but I think the three of you have hit it very well, that there are so many aspects of disease. We all hear about gastrointestinal disease. There are different pulmonary diseases. You hear about lowering your immune level. Someone was telling me the other day that they had heard that former President Bush, when his wife died, that immediately after she died, he had to go back into the hospital, lowered his immunity. He became ill. So there are so many things, sort of what you just said, that if you just Google stress, how it impacts your entire life. In cardiovascular diseases, there are so many disease processes we deal with. We talk about stress and hypertension. If someone has long-standing stress, can they have increased catecholamines, which can cause vasoconstriction of the arteries, which can lead to hypertension? And now if you have hypertension, do you have an increased risk for cardiovascular disease, heart attacks, etc.? So stress really can play a role in your everyday life. I have patients that I hear who are stress eaters. They may have just had a problem with a friend, problem with a grade, something like that. Next thing you know, they're having a, quote, pity party, and suddenly they're eating big tubs of ice cream as if that's going to make them better. Stress is real. We deal with stress all the time. We see people, there are people who come into my office and have what we call white coat hypertension, meaning if they were home and having their blood pressure taken, it's fine. But the stress of walking into a physician's office, you take their blood pressure, it's now in the hypertensive range. So these are things we have to deal with. You try and do it, at least I've tried to do it for years, holistically. You talk about patients changing their lifestyle, exercise, losing weight, but sometimes you actually have to use medications on these patients. So it's a real phenomenon. It isn't just someone sitting around saying, gee, wouldn't it be nice to lower stress? It's a real problem, and it's costful, which is the best channel to pick. I've seen many patients in their 20s who come in to see me with palpitations, different disorders that I relate to stress. You're right. And it's interesting, if you go back later and listen to the question you just asked me, it was stressful just listening to it, because we're in a time where stress is part of our lives, unfortunately. The digital age, everything, it's hard to just be quiet. You hear people talking about, maybe we should have a weekend where we put our iPhones down, take off our headphones, and just try and turn everything off. I have a son who loves to camp, and he goes out hiking, and he's away from everything for 2 days, and he's very happy. And I think that's a good thing we should all do at times. I think it's very important. If you guys get a chance, sometimes just sit back and watch some movies or television shows from the 90s. Or even early 2000s, where people weren't walking around with their phones and it wasn't just constant communication. I think people were a lot more relaxed. And I think it's the era we're living in where people are a lot tenser, a lot more stressed, just based on what's the next tweet I'm going to get. It's just amazing what we're doing to ourselves.
And also, positive mental attitude, healthy eating habits, a good amount of sleep, a good fitness routine. Could that relieve stress in one's life if they are strong in those areas that I just mentioned?
Well, it's not even just me believing it. I think it's been shown in the medical literature that will happen. We talk about leading a healthy lifestyle. Patients with hypertension, it's been shown that one of the first things we do before we even start talking about medications, many of these patients are overweight. You talk about changing the way you're eating, watching your salt, getting exercise, losing weight, and then have the patient come back usually in a week or 2 or 3, and frequently you'll see a drop in their blood pressure. If you knee-jerk and just start them on a medication or a pill, that's not the best thing to do. Just because you have fame and just because you have financial security doesn't mean you're going to be happy. It doesn't mean you don't have stress. In fact, sometimes when you have success at a very young age, the problem is, what's next? If you have all the success at age 22, what are you going to do when you're 23? and you have to realize you have to maintain that, or trying to maintain a certain lifestyle. That's incredibly stressful, and